One of the reasons in our office that we are constantly changing things is because my team and I believe very strongly in continuing education. And the reason for that is basically things are constantly changing in the world of dental materials and in dentistry. So we do spend a significant amount of time traveling to different venues to learn new techniques for all kinds of things. We have gone for several years to improve our service, basically. And while this is a purely practice development type of continuing education, it has taught us how to communicate with our patients. I think that, honestly, that's one of the most important things that we could have learned as far as continuing education, even though it's not a technical aspect of dentistry, because it's allowed my team to really put themselves in the place of the patient and to understand what it is that the patient is feeling when they come for the first time to our office. So we do spend a lot of time on customer service. We do spend a lot of time on improving the experience that the patient receives when they come in. I tell my team a lot of times that if you put yourself in the place of the patient, you're going to understand that when they come in here, they're nervous. They are sharing personal information with us that they are hoping we are not going to judge them, and that's not our job to do. It's not our job is to help them and not to take that information and make them feel bad about why they haven't been into the dentist for 10 years. Other things that we learn in continuing education are just simply techniques and materials, changes in why we do certain things. Different types of anesthetics come out all the time. We need to learn how to administer those. We need to learn what the side effects of those are. We're constantly learning about different types of porcelains that we use in our cosmetic dentistry, why some porcelains are stronger than others, why we would want to use one porcelain in one type of case over another. So there's a lot of little nitpicky things that we have to constantly keep on top of, but we enjoy it. We like it because we want to make sure that we're always offering what's at the cutting edge of dentistry. And normally we don't offer it right off the bat because I'm one of those people that likes to sit back and wait to see if there have been any changes and if there have been any downsides to using the new material. I like to test it out. It's kind of like when the new Apple computer comes out. You want to wait and see before they work out all the kinks. That's kind of what we do. And then we introduce it to our practice, and we introduce it in a way that we've tested it on ourselves most of the time. And we've gone through the process so that we know what the patient is going to expect, and we can decide whether or not it's acceptable to us. If we like it, then we're going to go ahead and offer it to our patients.